Dr. Arfan Hospital. Today we'll have a simple introduction about the basic life supports. Okay, most of you they attend the basic life support at 1 month ago or weeks ago. So try today to concentrate on the basic life support adult scenario. Check responsiveness. If no response, shouting loudly, checking the shoulder of the patients, go and activate the emergency medical service. 997 in the community, 444 in our hospital. Then come to your patients and do A, B, C, D. A, open the airway. You are in the phase 2 of learning, as you said, you can use the head, tail, chin, left if no neck injuries, or jaw thrust method with neck immobilization if there is suspected neck injuries. Then look, listen, and feel for the breathing for 5 to 10 seconds. If no breathing, what you will do? 2 rescue breaths. What's the criteria of the breaths? Each over 1 second, with 1 second pause in between, using a pocket mask, okay, or ambu bag, using a pocket mask or ambu bag, okay? You will deliver each breath over 1 second with 1 second pause between. The tidal volume criteria, tidal volume enough to raise the chest wall. Once the chest wall is rising, stop inflating. Okay? Then come to C. C, which is circulation. You have to elicit the pulse. Where are you going to elicit the pulse? You are professional. You can check the pulse in the carotid area or in the femoral area. How to check in the carotid? In the carotid, this is Adam apples. I will slide my finger until they reach the groove between Adam apples and the muscles, sternomastoid muscles. From Adam apples till I reach the groove. I have 5 to 10 seconds to elicit the presence or absence of the pulse. If no pulse, start chest compressions. Okay? If no pulse, start chest compression. You have 5 to 10 seconds to elicit the pulse. Don't elicit the pulse on the other side. Elicit the pulse to the side near to you. While you are maintaining the airway open by the upper hand, maybe the patient has pulse, so just continue rescue breathing. So if you will, no pulse, everything has a reason in the American Heart Association, because if you elicit the pulse on the other side, the surface area here less, very small, the tips of the phalanx only. But if you elicit the pulse here, the whole phalanx, so the surface area is better. So everything stick to the rules. The rules here, check the pulse near to you. Then you start chest compression. Where's your landmark? Just below the nipple or beneath the nipples in the lower half of the sternum. You have a lower half of the sternum in the middle line. You have beneath the liver. Maybe the Saudi Heart Association is still recommending using the old message. Your finger on the postal margin until you meet groove, then 1 finger above, put your hands. But it's easy to put the nipple line just beneath the nipple line, in the middle line, in the lower sternum. Using a heel or both hands. A heel or both hands. Using a heel or both hands. Your finger should be extended or interlaced. Finger extended or interlaced, okay? Because if it's like this, it will touch the ribs. So you'll cause fracture of the ribs. The aim is not to do fracture of the ribs. So your finger should be extended or interlaced. Or if you have arthritis, you can do it like this. Okay? So you have 3 options, but don't put your finger on the ribs of the patient, okay? You will lean forward. That's why usually we are using footstool. Either you put the patient on the floor or you will be above the beds. You will lean forward until you reach the point of natural imbalance. What's the point of natural imbalance? I will lean forward until I reach the point of natural imbalance. The point where my shoulder